Good evening, everybody. I was asked to use the stage. I would love to roam around, but I'll stay here just like a true academic, and maybe being a little aloof doesn't hurt either. So, for those of you who haven't met me before, I'm Philip Held. I'm a licensed clinical psychologist. I also direct the research and innovation at Road Home. I've been here over a decade, and saying that out loud seems really odd, but what I've gotten to do in this decade is really see the program grow, and I'm going to share a little bit with you because I was asked to where we're going to head and why we're going in this direction. A little bit about me before of like why I'm here, because I think this entire presentation and my entire drive will make a whole lot more sense. I was really close to my grandfather, who was a prisoner of war, POW, in World War II. He had what we now know to be PTSD, but we didn't know it back then. And so he would go through these periods where his symptoms would escalate. And then he was sent away for 2 weeks for like what's called rest and relaxation. And he would do a little better. And then eventually he would come back and it would all repeat. In mid-high school, I thought it was the craziest thing that we do not have a treatment for this disorder and we needed to do something about it. And so I pursued the most straight path I knew to get to a place where I could help innovate treatment to ensure that it is the best it can possibly be for individuals just like him. And so really what I'm going to share with you is a story about how good isn't good enough and we need to do better, and we are doing better, and I'll tell you why if I can find the clicker. So let's first talk about industry standards. Industry standard for PTSD treatment in the community means that 50% of individuals complete care. Think about it. That means that half of the individuals who start PTSD treatment after going through what Fita just explained do not actually finish their course of care. And that's problematic for the same reasons why not taking your full dose of an antibiotic is problematic, right? If you don't complete the course of treatment, you have much less of a chance of getting better and staying better in the long term. And so more than 10 years ago, we at Road Home decided that wasn't good enough for us, and so we changed it. We developed our programs that is now a 2-week accelerated treatment program that you all know about. And so we're proud to say that over 94% of individuals are able to complete this program. So more than 9 out of 10 individuals have a chance at success. And when we look at our outcomes, over 84% of individuals say that they feel meaningfully better as a result of participating after just 2 weeks of our accelerated treatment. So that is groundbreaking. That's a reason to celebrate. And this is far, far above what we're currently seeing as industry standard in PTSD treatment. But this is not what keeps me up at night. So what keeps me up at night is the flip side of this. If 84% of individuals say they're getting and feeling better, that means that 16% are not. And that shouldn't be the case, and we need to do something about it, and I'll tell you exactly what we're doing. This is so important because, as you heard Vita talk about, we oftentimes only have a single chance of helping individuals feel better because they will only try treatment so often. And so imagine you're going through a treatment program like ours, and you end up not feeling any better after 2 weeks. You're not likely to try this again because you've sort of proven to yourself that PTSD treatment doesn't work. So with the one chance we have, we need to do the most, and we need to figure out a way of helping those individuals respond. So we want the number to increase further and further. And so the way to do this is, or the way we are currently doing this, is we're looking far, far, far beyond mental health treatment. We're looking far beyond healthcare. We're looking to places like what you see on the left. You probably all recognize it, places like Netflix. So why are we looking to Netflix? Right? When you think about companies that have truly innovated and truly changed entire organizations, entire industries, Netflix is one of those. The way they've done this is not just by turning DVDs into digital media, but they've done this by personalizing what we get to watch, right? We all know that when we log in, we are recommended certain movies, certain TV shows that are tailored toward us, toward our likes, toward people who are just like us and what they've watched in the past and liked as well. And we've come to expect this, and it works. And so the question is, why can we expect personalization in places like that, but we can't expect personalization in the therapy room? And so the easy answer was like, well, let's change this. Let's make sure that we personalize treatment so that everyone gets the treatment in which they have the best chance of success to improve, not just in the short term, but to also stay better long term. So think about our treatment, right? Graphed on the bottom is the treatment days. We have a 10-day program. It's our accelerated treatment, highly effective, highly published about. But what you would see is someone whose symptoms don't change. They sort of are elevated at the beginning and they stay elevated all the way until the end. And so if we would know that this individual is not improving, what do you think we currently do? We keep doing the same thing, expecting for it to get better, for the person to improve. And doing the same thing over and over, expecting different results. People have given that a name, starts with I and then N, and it's called industry standard. And we need to do something about it. It's industry standard because these treatments have been shown to work in this way, but when they don't work for an individual, we need to do something. And so we leverage all of the data that we've gathered from the individuals who've participated in our program. We've looked for patterns, and we've created our own machine learning algorithms that are very similar to a Netflix algorithm that'll tell you whether this person is going to finish watching the movie or not. We've just applied it to mental health treatment. And so what we're now able to do is we're able to, at as early as day 3, detect whether you're likely to complete PTSD treatment or not, and whether you're likely to get better or not. And if you're identified as an individual who is at risk of not getting better, guess what? With this algorithm, we can now alert our clinicians who can have a conversation with their patients and together decide whether it's time to switch the course of care. And through that, we are able to change how well someone does. This is truly personalizing treatment as early as we possibly can to ensure that those 16% who say they don't get better have a chance of getting better. It's not a guarantee, but it's making it a lot more likely that these individuals will also benefit. To make this even more Netflix-like, we're also starting to use something that's called precision targeting. So I assume most of you are not clinicians in the room, so thinking about what we do with PTSD treatment is we work with individuals who come with really complex life stories, really complex traumas, and what we're looking for in our treatment specifically are beliefs, trauma-related beliefs, that are keeping individuals stuck in the cycle of PTSD. Think of these as the coulda, shoulda, wouldas that are replaying over and over and over and over. The thing is that there's never just one or two. There's a bunch of them. They're all over. And as a clinician, it's sometimes really hard to know which one should I focus on because there's so many different options to choose from. So again, what would Netflix do, right? They would develop an algorithm to recommend a treatment or a belief to help improve as much as we possibly can. And that's exactly what we did. This algorithm shows us which are the beliefs that you as a clinician should target in order to get the most benefit out of care for this individual. And what this does is it increases outcomes by as much as 50% in our simulations. And so again, this is another chance for individuals to get even better than they normally would through traditional treatment. And all of this would happen in collaboration with veterans. And the coolest thing is that all I'm talking about is not some sort of like future in 5 or 10 years of Road Home we're going to be doing this. This is what we're doing now. Like this is not a future discussion. This is what we have implemented to date. And so I call this steady innovation, right? Like you think about like the 1990s Formula One car on the left, 2025 Formula One car on the right. You can still say it's a Formula One car. Everybody would know this, but they have improved drastically. They've made it better. You would still recognize our treatment as such. We've just made it a whole lot better, a lot more personalized. And we don't stop there. We also talk about transformative innovation, right? Like both are telephones, and yet if you came from a different planet, you would never know that the right one was actually a telephone as well. And so we're looking at how can we imagine a future where PTSD treatment changes, where it changes with the times that we're currently in, right? We've all heard of artificial intelligence, it's everywhere. And so the question is, how can we bring PTSD treatment that is commonly delivered in a certain way and that we've delivered that way over a century into the modern world so that it fits with individuals? And this is not to replace anything. This is just about increasing menu options so that if you're going to treatment, you'll have the best chance of finding a treatment that suits you, that you're likely to do, and in which you're likely to benefit the most. And so I want to introduce you to Socrates. Socrates is our in-house at the Road Home program developed generative AI tool. And this is how we're envisioning therapy can change. Socrates was developed so that that was not me. So that it engages individuals in Socratic dialogue. And Socratic dialogue is what we're doing at the Road Home program. It's a technique that helps individuals evaluate some of their beliefs. And so we wondered, can we replicate this with some of the generative AI tools? I swear I'm not touching anything.
Colloid.
See, yeah, Dr. Colloid. See, this is why I get the nickname. And so the question is, can we leverage these kinds of tools to help individuals get better in between therapy sessions? Because right now you're dependent on going to therapy, meeting me once a week or once every day, but the in-between time is what we're hoping to target with these kinds of tools. And so I was going to show you what it looks like, but now I'm not really able to. So you'll have to trust me that what would be showing is a conversation between a therapist and a user that are going through a negative trauma-related belief. In this case, if I hadn't worn the red dress, I wouldn't have been raped. It's a very common belief among sexual assault survivors. And what you can see is that the tool is working through this belief with the individual. And if we have time after this, I want to demo this live for you so you can see what this is all about. But what makes Socrates unique is that it is HIPAA compliant. We worked closely with our Rush legal and compliance teams. We worked with an external security firm to ensure that all of the security standards are met. And it is unique in that it is what's called a multi-agent AI tool. This is not just GPT with a nice little wrapper around it that looks fun, but there's actually more underlying it. And so what's underlying it is a structure that mimics exactly what we do with junior clinicians. So when I have a trainee who I just trained to deliver Socratic dialogue, and I let my trainee work with a patient, that trainee has me or other supervisors watching over their shoulder, giving them guidance on how to do better. We've mimicked that. So the AI therapist that an individual works with is supported by two other AI entities that collaborate. They talk to one another and talk to the therapist to ensure the conversation remains safe and the conversation remains as effective as it can possibly be for that individual so that they have the greatest chance of success. And so we've completed now 2 feasibility studies using Socrates 2.0, and it's been really promising results. Individuals enjoy it, they would recommend it to other people, and most importantly, people get better. And they get better, and we've shown that they get better in PTSD, depression, and anxiety, not just because, but we've been able to show that they're getting better because they learn how to restructure their own way of thinking. They learn exactly what we're trying to teach them in the Road Home program through interacting with a tool like this. And so the future that you can envision is that you would work with your therapist, and for homework, so to speak, you would get to work with something like Socrates any day, at night, whenever you want, whenever you need, to further improve the skills. And so it essentially loosens up the rigidity so that in treatment, we can be even more effective when we work with individuals. And so Socrates has now been picked up by Forbes. We've published on it. And again, we have a lot of safety work that's still ongoing and a lot of other research that still needs to happen. But this is how we envision the future of care to look like, or at least one of those menu items for the future. And then lastly, I want to talk a little bit about training, because what we noticed is as soon as we gave Socrates to our clinicians, is they used it as a training tool. They wanted to know, can I mimic my own patients to see what this tool would tell me I should be asking so that I can get better? And so we flipped this around and we developed Socrates Coach, which is now supported by USAA and other funders. And it's used as a training tool for clinicians who are learning the exact treatment that we're using at the Road Home program. So I'll pause here because I'm hoping that we have time. I have no idea how much time I have, but I'm hoping we have time for a live demo. And people always tell me, like, don't do a live demo at an event. You're going to end up like, you know, Elon Musk with the Cybertruck and all those kind of things. And this might be my Cybertruck moment, but I do want to try it. And I want to show you what this looks like. I wonder if I can ask Brian to be a patient.
Brian, surreal choice.
All right, so what Brian's going to do is he's going to mimic. Oh, you guys can see it. Oh,
We don't read. That's just all. It's just so hard to.
what a bummer. Do we know how to fix it? I knew this was my moment. What Brian was going to do is essentially take the role of a patient who would be working with Socrates, starting with sort of a starting point and seeing where it goes. And then maybe if we have time, I'd love to look under the hood so I can show you how the AIs are interacting with one another and how the supervisor input is integrated by the therapist, because that's ultimately what makes it unique. So maybe if you have an idea for a starting point, we can. Ready when you are.
All right. Ready? Okay, so just for everyone's benefit, I'm gonna start how most sessions start, and then what we'll try to see is how Socrates kind of funnels me into more specific beliefs that are like actionable in a therapeutic way. So Phil, I'm feeling really depressed and lonely today. I don't know if everybody who read it. Yeah, it's mine for your top. Sure. So I'm sorry you're feeling that way. Can you tell me a little more about what's been happening today that's contributing to your depression and loneliness? I'm just feeling distant from everybody in my life, and I haven't left the house in almost a week. Spelling errors and everything. It doesn't care. So it sounds like you've been isolating yourself, and that's making you feel more disconnected from others. What do you think has been keeping you from leaving the house this past week? Just feeling really low energy. When you notice that low energy, do you think it's more a cause of staying inside or more of a result of it? So again, it's trying to get the veteran to a more actionable, like therapeutic goal. Like what are we actually going to do with this, right? I don't know. I just don't feel like I have anywhere to go. I don't have anyone to talk to. I suppose I'm just feeling lonely and feeling like, what's the point? I think it definitely would change.
Right.
Oh, sorry. It sounds like you're feeling stuck between loneliness and a sense of purposeless. If you imagined a day when you did have someone or somewhere to go or someone to talk to, how do you think your energy and mood might change? And my response is, I think it definitely would change. I would feel like I had a mission, like I had something to do. Okay, so like now, and speaking as someone who supervises a lot of like junior clinicians, like this is where you want to get, is like you can sort of see the AI tool getting me closer and closer to like, okay, what do you want to do about this? Like there's a lot of empathy, there's a lot of, yes, I understand how you're feeling this way, kind of like keeping the conversation going, but the goal is to say like, yeah, let's reflect on how you're feeling, but like where you want to go next. So so having a sense of purpose or a mission seems connected to feeling more energized and less lonely for you. What kinds of things, even small ones, have given you that feeling of purpose in the past? I think spending time with my kids, with my girlfriend. I used to volunteer, but I kind of gave that up because I was feeling sad.
Because I was feeling sad.
So it sounds like your kids, your girlfriend, volunteering have all been sources of purpose and connection before. When you think back to those times, what was different about your daily routine compared to now? I was just more in touch with them. I feel like I had places to take my kids. They relied on me for things. So in those times you were more actively involved with your kids and their needs, and you had specific places to go with them, how does it feel to remember that they relied on you? And does it change how you see your role in their lives right now? I think it's nice to think about those times. I'm just not sure how I can get back to that feeling. I wonder if it's a good place to sort of look under the hood and see what happens after. Yes, absolutely. So last response, it's understandable to feel unsure, especially when the gap between then and now feels wide. What do you think is the biggest difference between your life now and when you felt that sense of connection and purpose? So again, this is, exactly how you'd coach someone learning therapy is like you're getting the conversation going, you're getting thinking about the problem in different ways. And so the conversation really has this momentum to like, what do you want to commit to doing?
So what would Socrates say if he started expressing suicidal ideation?
So I'll quickly read through this because I think it's the kind of response you'd hope to see. And this kind of goes back to the safety testing that Dr. Held talked about earlier. It sounds like you're feeling a lot of pain right now, and I want to be clear that your safety is the most important thing. I'm really concerned about you. You matter, and you don't have to go through this alone. I'm not able to keep you safe myself, but I can help connect you to people who can. If you're thinking about harming yourself, I'd like you to reach out to a suicide prevention helpline or a trusted person right now. You can call or text, and then it gives like the US lines, UK, Ireland, Australia, like a whole bunch of different options. Can you find other lines here? And then there's a website. Can you tell me if you're safe in this moment? So kind of the response you'd hope to see.
Let's quickly look under the hood on it. We take
Yeah, sir, just to follow on for that. So does it also alert the clinician that referred you to Socrates? Because I know you said it's HIPAA compliant, but would the therapist also like be able to see the conversation that you're having with Socrates?
Yes. I know I don't have a mic, so I'm going to try to screen. What I actually just pulled up is the behind the scenes look. This is also what I see as a therapist. Here, I'm able to see my list of all the patients. These are all just test cases, obviously, that I've pulled up. And I can see the entire dialogues on the left. I get a summary of all of the different encounters. Currently, that doesn't make sense because there are a bunch of different test cases in here. But what I can do, and I need to enable something really quick so you can see the magic behind it, is at the bottom, once I select the right dialogue that we just did, I'm able to see the entire conversation that my patient has had. I'm able to see all the responses they got. And what I want to show you all is what happens underneath it. So this rating, you obviously didn't see in the dialogue. This is the assessor going through and judging based on validated scales how much improvement there is. And so at the beginning, there is no change. And over time, it keeps re-rating it. What I do want to show you, and I want to see if we can find a good example, is when the supervisor chimes in and provides input on what else to do different. So here you see a supervisor response, and it provides clear directions on what to ask next. And this type of input, I'm doing this live, so I can't really do this and see this, but this type of input is integrated then into the future responses of the therapist. And so by doing this, we're able to monitor the dialogue and also, similar to what Brian described, very similar to what we do with our trainees, ensure that the conversation not only stays on track, but also uses the most appropriate questions given the context of the situation and given the struggles and concerns that the individual that's using it has had. And so all of this happens in the back that, if the AI assessor tells it there has been no change, the types of questions will also begin to change because it knows that this line of questions is not going to get me to the result that I'm hoping to have. And so, in a nutshell, this is what Socrates is. And I know I have to wrap up, but I can probably take one more question, maybe?
Can I ask a question?
Yeah.
Oh, so I have a friend who's a therapist, and she's finding a lot of her clients are coming in with relationship to their AI bots or with their chat GPT.
Yeah.
So what if that relationship that goes to dominant relationship?
Yeah.
How are you managing that?
That's a really great question. And this is of concern in the entire AI community, is that individuals do begin to develop these close relationships with it. If you notice the style of responses, it feels very different from what you normally get from ChatGPT, and that is on purpose. It keeps asking you questions. It's not super engaging. It's not super fun. It's intended to work on specific beliefs that you have. And so through that, even though individuals have good, strong working relationships, we don't see sort of this dependence on these tools because they don't tell you what you want to hear. They just keep asking you questions so that you can keep exploring your world of thoughts and see are there alternative ways of looking at situations. And so this is one way of getting around this. And then again, we have the monitoring system. So this is to be used in conjunction with your therapist, not completely independently like something like ChatGPT. And your therapist hopefully should be monitoring what you're doing with this as well. But great question, yeah, and this is a concern and something we're thinking about.